Today, I want to show you how I explain EMDR to my clients in a way that actually makes sense and feels human. And if you're an EMDR clinician, make sure that you hit subscribe. For context, I'm a certified EMDR therapist and EMDR consultant in training. And I teach clinicians and clients how EMDR actually works in practice. One of my favorite questions to ask clients when I'm trying to explain EMDR is, how much do you want to know? Do you want just the basics, or do you want to geek out about the research and the brain science with me? Today, I'm giving you just the basics, the core understanding of EMDR. If you want to go deeper into the science, I'm sure that your therapist would love to have that conversation with you. So make sure that you ask. If your EMDR therapist can't explain that, it doesn't automatically mean that something is wrong, but it's definitely worth asking questions and exploring further. So EMDR stands for eye movement desensitization reprocessing, not to be mistaken for cue music EDMR. In short, it's considered a gold standard treatment for trauma, but we'll unpack what that actually means. EMDR was developed in the late 1980s by Dr. Francine Shapiro, a psychologist, who noticed that certain eye movements seemed to reduce distress while thinking about traumatic events. Traumatic memories aren't really about the content, they are about time orientation. This is important in EMDR. When we're experiencing overwhelming events, our brain and our nervous system can be overloaded, and memories don't get stored in a fully integrated way. Instead, they often get stored in fragments connected to emotions, body sensations, and beliefs from the moment that the event happened. So when we get triggered in the present, it can feel like the past is happening right now. And with EMDR, we help process those memories so that the past can feel like the past again. I often explain what we're doing in EMDR kind of like trying to clean out a filing cabinet in which we took all of these pieces, fragments of paper, and just shoved it in there during a time where we were completely overwhelmed. We did not take the time to neatly file them away. What that means for us is that all of those papers were certainly not labeled and not organized in a way that feels really helpful. With EMDR, you and your therapist are essentially cracking open that cabinet and organizing those files, updating the information, and relabeling things so that your brain stores them in a more accurate and integrated way. We're not throwing files away. We're not getting rid of things completely. We're just making sure that they are stored in the right place with the updated meanings. This is the part everyone talks about and everyone wants to learn about: bilateral stimulation, or the mechanism that we use in EMDR. We often call this BLS, and that is the eye movements that people usually think about when we think of EMDR. But it can also be tapping, it can be auditory stimulation. And two main reasons that it works is that, one, it might mimic the process that happens during REM sleep when memories are just naturally consolidated. And the second theory is that it may tax the working memory while we are recalling those distressing memories, which reduces their overall emotional intensity. The truth is, though, that we don't fully understand every detail of why and how EMDR works. We just know that it works. Some people ask, is EMDR hypnosis? Is it pseudoscience? These are totally fair and great questions, and the answer is no and no. Since it was founded, there have been over 40 randomized control studies supporting its effectiveness, especially for PTSD. This matters because randomized control trials are considered the gold standard because they help determine whether improvement is actually due to the treatment and not just time, attention, or placebo effect. EMDR is not just evidence-based, It's been reviewed, supported, and effectively co-signed by major organizations like the American Psychological Association, the World Health Organization, and the US Department of Veteran Affairs. Originally, EMDR was studied for trauma, especially PTSD, but over time, it's been applied to things like anxiety, panic, depression, attachment wounds, performance issues, and other distressing experiences. It's not limited to trauma anymore, it is a broader memory processing model. Just like any therapeutic modality, especially when we're talking about trauma treatment, there are both risks and benefits. This list isn't exhaustive, and if you have special concerns or personal considerations, that's definitely something to discuss with your therapist. Let's start with the benefits. So, in EMDR, we're processing stuck memories, updating negative beliefs, reducing emotional intensity connected to beliefs. We're practicing nervous system regulation, increasing insight, and often clients experience relief, clarity, and a sense that the memory feels different, not erased, but more integrated. What are some of the risks of EMDR? You may experience temporary emotional activation, increased distress between sessions, vivid memory recall, body sensation surfacing, sometimes weird or vivid dreams, feeling fatigued or emotionally keyed up after a session. These reactions are common and often just part of the process. And we monitor safety and pacing based on the client's nervous system. When people think about EMDR, they often only think about the reprocessing part of EMDR, but EMDR is so much more than that. It's an 8-phase treatment model, not just a technique or a tool. The 8 phases that you and your therapist will work on are history taking, preparation, assessment, desensitization, installation, body scan, closure, and then reevaluation. And if you take nothing more from this video, I hope that it is this. EMDR is so much more than eye movements. Reprocessing does not automatically begin in the first session, especially with clients who have complex trauma. It often takes multiple sessions of preparation before moving into reprocessing is appropriate. Readiness matters. Safety, stability, and strong resources come first. If you're a client watching this, I hope this gives you clarity about what you and your therapist are doing together. If you're an EMDR therapist, feel free to use this framework and adapt it to your voice. And if you want more insights, tips, and free handouts, make sure that you hit subscribe and check the links below. Thanks for watching this video. I'll keep sharing more about making EMDR relational, human, and clear.